We don't play favorites, though. We don't play favorites.
Yeah, I told Debbie you'd be back, we could take her, so.
No, I didn't say anything.
Are we up and running?
Yep.
Okay, we will call the meeting to order. It is Tuesday, May 12th, 2020. We will stand for the Pledge of
We
Allegiance.
already did that.
I know, that was this morning. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Born and unborn.
Okay. Last week, we got $9 million in for the coronavirus relief fund. We're still kind of trying to figure out what is covered and what is not. The CARE Act provides the payments from the funds may only be used to cover costs that are necessary expenditures due to the public health emergency with respect to the coronavirus disease 2019. Were not accounted for in the budget most recently approved as of March 27th. For the state or government, and were incurred during the period that begins on March 1st, 2020, ends on December 30th, 2020. So it is going to be, it has to apply to COVID-19. And we still kind of are.
We're still working our way through the process.
Yes.
There has been some frequently asked questions that were updated on May the 4th on the state treasurer's website. I gave you guys a copy of that this morning to look over. Right now, we really need to come up with a process more than what we're going to spend it on. It's been suggested that maybe we do sort of like a grant application and award system where you guys would make case-by-case determinations, and the possibility of breaking it up into multiple rounds of funding. So doing, for example, protection being like PPE, prevention, so items put in place to prevent the spread, and then maybe a recovery portion. Like you said earlier, there's still a lot of questions regarding how and what these funds can be spent on. I think it's pretty clear when it comes to PPE and things like that. Yes, that would be included. I think there's some gray areas in other areas of it. And we definitely would have to have some sort of written agreement if we were to give this money to anyone else besides the county.
Yeah, hopefully we will get more clarification. I think we need to come up with a form or something that is submitted, so that we kind of know. We can't have EMS just, going out and purchasing PPE.
Yes.
We can't,
Yes.
We need to really track it and account for it, since the county is responsible and I signed for it. I don't want to go to Leavenworth, so I'm going to send Kristen
So
instead.
ultimately, the county is responsible and liable for all of the expenditures and making sure that it's approved and spent appropriately. This is and could be a full-time job for someone. I think at this point, we do not have the staff to do this. We have set up the fund. We will help with any of the financial aspects as far as running through our system. But as far as running this grant, we're a 2-person office that is spread pretty thin at the moment. So my recommendation from the get-go would be to either hire a consultant to help us manage this, or hire an employee to manage this for us.
Do we have
a consultant in mind, or?
I have briefly talked with Williams Keeper since they're here doing our audit.
Right.
They do have a team that's working on the CARES Act itself, so we could reach out and see if that's something they would help us with. I do know there's some other resources available. I did sit through a NACO webinar, and there was some information on consultants and contractors that do this for a living, and things to look for if you're looking for someone.
I guess that would be my preference, is to find someone that could do it, versus hiring someone. I don't know if we need to bid that, or if that would be a professional service, or,
I think that would be a professional service. Jill, am I correct? I mean,
Arguably, yes.
you could do an RFQ if you
Right.
wanted to request qualifications.
I mean, that's where I would be, maybe find 2 or 3 and just get an RFQ for them and see what they could provide for us and what kind of, cost, whether that was hourly or monthly or whatever.
Yeah, I had brought up Mark Ruther at the treasurer's, but there seems to be some complications there, but I thought, well, he is a CPA, and, the treasurer is, controlling our money, but, so that was next, so.
I think that the county internally also needs some guidance because there are multiple sources of funding at the moment. Some being CARES funding, some being public assistance. We need some guidance on if there's particular expenses that you want to go here versus public assistance versus, I know the clerk's office got a grant. I know that the sheriff's working on an additional grant through JAG. So there's multiple funding sources at the moment. We kind of need to determine the things we've spent already and which funding source, because we can't double dip on anything. So what you submit to one, you cannot submit to another.
Sounds like that would be just a question, part of the grant application. Have you requested funding from other sources?
It is, I think definitely from everyone outside, but we also need to determine on the things we've already spent, which
Right.
funding source we want to submit the reimbursement from. Cause there have been, quite a few expenses on our side already that we have already paid for.
So,
I saw that Jackson County is using it for the safety partitions.
So that's something else. I do have multiple offices, some that have already put in windows, others that are asking for some like plexiglass and things like that to be put in their office.
so can that be an internal process, similar to the grant process? Are you wanting reimbursed for this, from county? I mean, I think it should function the same because, just in my view, have we paid for this? Is this something that you want reimbursed out of your office expense or whatever? And what makes it COVID related? I mean, just a series of questions that doesn't have to be too complicated.
So some of that, we created those emergency lines earlier. There's
Right.
one in the sheriff, one in EMS, and one in general fund, that we have been trying to track those COVID-related expenses in those lines currently. The initial, before we knew about the CARES money that we received, they were all being submitted through public assistance. that was the route we were going because that was the funding source that we knew at the time. At this point, we can still pull those back if we need to. But we need to go through that list of expenditures and decide. There is some time frame differences, so public assistance, you can go back to January the 20th with expenses. The coronavirus relief fund, you can only go back to March 1st with expenses. So I think that our only option with any expense between January 20th and March the 1st would be through public assistance. Anything from March 1st forward, we have the option to go either way.
Carrie, has the city done anything at City Hall or like that? Do you know? Okay.
As far as like partitions between the public, are you talking about improvements?
Yeah, that you have done because of
We,
COVID-19, you're trying to separate the public from your employees. I was talking to Doug Reese today in St. Martin's too, and they're limiting their meetings to 15 people, and they have some other stuff they might want to.
we have made some changes.
Be doing
We also have
too.
some that we would plan to make too that could possibly be incorporated into this as
Okay.
well.
Because it is money that our municipalities in Cole County can use, so Doug had called me about something else, but I was talking to him about that too, so.
So all the stuff previously already submitted, I mean, do we have a list of that we
I can run
go-
you reports of everything that's come out of there. I think the bulk of the expense at the moment is through EMS.
Okay,
Last I checked, we were around $50,000-$60,000.
And has some of this already been filed with SEMA and FEMA, or?
So Sierra's been working on that. We've kind of been compiling the information, but nothing's been approved or anything through them, correct?
No, and I told them that it was, we were gonna vault it, so we figure out what's happening with this.
Right.
Okay.
And that 60 so far, what we paid out, not what is still to come.
Correct.
so how do we develop some type of a grant process? And look at, I mean, I like the 3 categories or 4 categories or 5 categories, whatever it is, and break them down into categories. Education, did one of those fall into that, or? I mean, if there's other categories that you didn't touch on, I mean.
Yeah, I'm open to suggestions.
I wonder if Missouri Association of Counties has anything that they've worked on, or
They,
if some of our other counties have
The
already
only-
created a farm, maybe we can borrow it from another county.
I was gonna say, I kind of went out and searched that what I could last week to see if any of them had an application already formed, like on their website or something. I have not seen
So
anything
they're,
yet.
they're just as confused as we are.
I think that every county at the moment is kind of in the same boat. We're all trying to figure out for sure what we can and cannot spend it on, and what that process looks like. And just like everything else with counties, I think they'll all take a different approach to it, so.
So really, I mean, we're stuck with 1 category for right now, until we have, or maybe 2, or protection.
I mean,
I feel like protection falls, COVID-related protection expenses, such as PPE and other items, we could move forward with some of that. And then maybe Christie could work on some of the education piece.
Yeah, we had that under our prevention category before.
I mean,
so yeah, we kind of thought protection would be the PPE and equipment needed to protect our people. Prevention would be like your screens and things so that we can open back up and work with the public. And other things that.
And that will cover testing if we start testing.
So I think that would probably, for a category, you'd want to do a treatment one, so you do your antibody testing, like what is it to treat the patients, screen the patients, things like that.
And response.
So it'd be basically a response.
Well, no, I think you do protection,
Protection.
response, and, education.
Yeah, because
Yeah, but I think response needs to be a separate animal.
So protection, prevention, response, education.
Those are a pretty good start, but I think I think, number one, as far as getting someone that knows about grants to be able to put some of this together, I happen to know this girl that works for the emergency management, and she does real good at grant stuff, and we just hired her. I'm not gonna mention her name, but, she might be a good avenue to go to when we talk about grant stuff. And then, the other thing is, I think we've talked about it, I know her and I have, and I've talked to some other entities about putting together some committees, to be able to look at some of these, the PPE versus response, so that, with the Chiefs Association, LEPC, we can put together some people to start coming up with, what their ideas are, because we don't even know, for instance, fire protection districts, if they've encumbered any money, for this COVID, we just don't know that stuff. So I think if we try to put together committees to be able to gather this information, we'd be better off.
it has into here too that maintaining state prisons and county jails is also
I think that
qualifies.
protection,
Yeah.
like Matt was talking about, the protection part.
Mhm.
I think we've been doing a really good job of working together and trying to buy together some of the PPE and things, if we can continue that process as well. So if there's things that we can buy together and spend those funds together so that we have all that documentation together, would be helpful as well.
Yeah, it says expenditures must be reasonably necessary. So there goes my portion.
Good job, you write it.
No.
I'm just saying, Kristen, don't be close-minded.
They recommend establishing a process in the nature of a grant application and award system in order to permit entities to request a portion of the funds. So, that's what Mac had sent out. So, and I think that, I like that idea.
I don't think it would be too terrible of an idea to piggyback off how our stock works when it comes to federal trickle down to state, just our subawards, that we wouldn't have to reinvent the wheel. And it's basically the exact same thing. Money's coming from the county and being dispersed out to those grantees, whatever.
See, smart.
As long as
we have to
that
know,
pass
yeah.
through is documented and certifications made that they're spending that money correctly as well.
Cause we're on the hook for
Yes.
it, not them.
Yes.
Mhm.
So, kind of, sort of, yes.
Yeah, if they sign it, I mean,
When you write
No.
the stipulations,
Uh-uh.
and the
Right,
guidelines, you
right.
have to follow
if they
them.
sign a document saying that they spend the money inappropriately, or,
It's not acceptable.
Well, you could put it in the application, like certified assurances for our federal pass-through grant that we have to agree to. And then when we sign the actual, grant document, it repeats all that, and again, you sign that you certify that you're in compliance.
Yeah, but then we have to guarantee that their use falls under a certified COVID expense, and we have to make sure that they use that money to pay for it. And so they have to submit an invoice that guarantee that that's what the money went for. So, not just somebody saying, yeah, I'm gonna use it for this. It's the whole paperwork trail from ordering to receiving to expending to.
So we could structure it to be reimbursement only, to where they have to spend the funds before they can get reimbursed for those funds.
or have an agreement in place that, you know, this is what we wanna buy, and that's the whole grant process, is that what we wanna do.
And then
it's
submit your documentation.
reimbursable once those things are purchased.
I like the idea of having to expend the money before we say yay or nay. Because you're saying that you're gonna spend it on this related
Right.
item or.
I don't mind,
or-
yeah, I mean, I don't mind saying yay or nay, or having an agreement up front, but now you need to purchase it, you need to expend it, you need to turn in a receipt, and then we'll reimburse. And we talked about that the last time. I mean, that's like, I mean, we're guaranteeing the funding, so, you know, gives you the ability to go out and purchase it. I think we need to start small, and if we can do the protection and the education, and if there's something else that maybe we can learn from some of these smaller ones as we go, and so then we can build out the others until we get more direction.
Yeah, I wanna be very careful on how we spend it and what we give out until we really know. Because ultimately, the county is responsible for it. If it's disallowed, then we're kind of out the money, we have to pay the state back. And so we need to be very, very careful on how we expend the money.
So I think the first step in the process is we need to develop that application process.
Steve or Carrie, do you have anything you want to add, or?
Well, I certainly think that it's a good idea to have the consultant, and they may have some thoughts on process. It also seems to me that there's some expenditures that have already occurred, and I know in our case, those are kind of the things that you mentioned, you know, there's some masks and personal protection equipment and shields like we did for our buses, so some of those expenditures have already been made. Maybe those could be done a little bit quicker. And then it also seems to me like there's some projects that may be coming that may fit in some of those categories differently, but nonetheless, there are projects or items that haven't occurred yet and may be coming. It seems to me like if you have an application process, you kind of need to know what those categories are, so you're applying for the right thing, and otherwise, you know, we've got a lot of projects that we could certainly submit, but for future projects. But I don't know, you know, which ones may be the kinds of things that you're thinking about. I'd also note, and I don't know how it came through on the language, but I know that there's some cities that are providing, using that CARES grant money for businesses, for grants to businesses, and then also for utility payments for people and entities that have not been able to make utility payments. So I'm not sure how they're, you know, what rationale they're using for those kinds of expenditures, but there are some that.
I think that's currently the gray area we're talking about. It's
Yeah.
not real clear exactly what those uses are, and up to interpretation. We just don't want to make the wrong interpretation at this point.
I would say that if there's a way to get some kind of, at least a consensus, you know, approval, but a consensus, so the cities have some idea, you know, that whatever they're thinking about is something that at least you all would agree to as well, then we don't need to worry about arguing about it later on, like after it's all been expended and done. And it's a short time frame, so I know with some of our purchasing procedures, you know, that's kind of a long lead in some cases for some of those future kinds of projects that may come.
I've been talking to Judge Joyce about the opening of the
Yeah.
courthouse, and I know she's got some ideas on safety things she wants to do. When is your municipal court going to open again, do you know?
Well,
or-
we were planning on, I think it's May 27th, but with some of those comments from the judge, you know, we may be complying with whatever that direction is. And since municipal court really is a function of the county court system, you know, that we would hope that if there are some needs for personal protection kind of equipment, or even masks, for example, for people that are coming in, that those would be provided by somebody other than the city, whoever's making the order, that those are needed, which seems to be coming from the county. So there's a lot of stuff out there. I mean, there's a
Yeah.
lot of little things.
Yeah.
But then, I mean, all the other cities in the county, I mean, that adds up pretty quick. And then there's certainly a lot of things. And then there's also some projects that I think, probably not, here's not the place to talk about it, but that may be a future kind of project that serves the county and all the cities as well.
And Steve, you might have touched on too, the fact that I think having the grant process is good, and then there may be an opportunity that we may want to have a discussion, where we can talk about some of those big picture things as well.
Yeah, we just need to know, paying somebody's utilities, that's gonna be somewhere down the road if that's allowed even. Yeah.
Well, and then that would come into play too. I mean, if that business had applied for CARES funding and got CARES funding to cover rent and utilities and payroll, they'd be disqualified from applying for this. And so how are we gonna know if that business took advantage of other CARES funding? And I mean, I think that gets into pretty complicated process, and a lot of people would probably sign their life away and say they didn't use it or didn't get it or whatever, and just try to get extra money.
Yeah, I think at first, we would just look at things that really do apply to COVID-19 in our government units before we start.
Can we get some clarification on payroll expenses? Like if staff are already, employed by the county, but they're directed to work on COVID expenses, and then like as it stands now, our nurses that were on call for the weekends, they don't get any compensation except for those hours they were actually worked. Can we compensate them for being on call? So I think we had been tracking our hours, but we did not, and we know who was on call for the weekends, but that our staff that are on call 24/7 don't get any compensation for that.
So I think the guidance that we've seen so far is that if we budgeted someone for public health and they're still working on public health, yet it's something slightly different from what they were there, they were already included in our budget. So would it be any additional expense, so like their overtime and things like that would be covered?
Number 3 here says payroll expenses for public safety, public health, healthcare, human services, and similar employees whose services are substantially dedicated to mitigating or responding to the COVID-19 public health emergency.
Right,
So-
like Kristen said, but we already are.
Right.
budgeted.
Yeah, and I
Right.
don't know.
So
And
if,
then our overtime,
That
we've
would
been having
be in
to
addition to
take it.
what's already budgeted.
right.
But
And I
we
think if
hired
you
new
took
people.
someone from my department and put them in the health department to help you during this time, you could say my duties were substantially different than what they were budgeted for. In that circumstance, you could take my salary and say, hey, this was substantially different than what it was intended for, because I'm not normally a public health
Right.
person. So I think you have to look at the bigger picture there.
And then I know that some departments are doing like hazard pay for the employees, they're also compensating them for being on call.
So I think that what we've seen there as far as guidance is that you had to have a policy in place for that hazard pay or whatever prior to. So since we did not have a personnel policy in place prior to that said in case of an emergency, we would pay hazard pay for this or that, it's hard to go backwards now because the policy wasn't there before.
And then another thing that we really want to explore, which it's probably more in the response category, is a contact tracing software. Right now, we do it all via Excel spreadsheet, but they have some new software that some of the other counties are exploring that help with contact tracing and tracking. So we want to explore that. I don't know how much that is, but my staff are looking into it.
So I guess that's kind of the question, the immediate needs, such as putting up that plexi in certain offices so they can open back up to the public, or, things that have already been spent. What do you want us to do in the interim with those things until we get the application process in place? And it sounds like the city has some of those types of expenditures as well.
Hurry up and wait. In all reality, I mean, if we need to do some of this stuff for doing the tracking that Chrissy recommends, we need to decide if we wanna do that right now, because it doesn't look like it's going away anytime soon. So we need to decide if we're gonna do that totally separate of whether we're getting money back for it. So I think those kind of decisions just need to be made apart from this grant. And then if you're gonna make the expenditure, then you can always figure out where you're gonna try to get it reimbursed at, if it's gonna get reimbursed. So, if that makes sense.
So the additional hours that the health department employees worked beyond what would be considered normal salary, those are just lost, or?
Well, so if they're a non-exempt employee and are working overtime that wasn't budgeted, which they don't have any overtime in their budget anyway,
But-
those hours would be covered.
Reimbursable.
But so what would be considered, I guess, what's considered a salaried amount of hours?
Well, it doesn't, it's whether you're exempt or non-exempt. Exempt means you don't get overtime, non-exempt means you do. And the law relates to what kind of duties you have. For instance, I'm exempt, and Matt's exempt, and David, that level. And so what you would do is just for non-exempt, anything over 40 hours, you would figure out what their per hour salary is, and then they'd get time and a half.
Correct.
Which is what your people's job.
Right, but my only issue is, it specifically says no bonuses, and if you were given compensation to those individuals and they work those weekends, right, if you were giving them a day off during the next week or something, you did?
We let them get comp time, but they did get, only if they incurred hours, like they didn't get any compensation for being off call.
Oh, okay.
And I think you'd have to pay them overtime and not comp time.
Well, we already let them use the comp time because
Right.
they had daycare issues and other,
And that's their choice.
I know, but I would have rather them get the additional pay. Right.
I mean, I was just trying to clarify, I mean,
We tried really hard to let them.
salaried
flex
employee,
them.
we don't expect them to work 80 hours a week. I mean, I don't think that's fair.
Like,
Yeah.
So, I mean,
Uh,
most of them are gonna work around 40, maybe 45. You know, it might be a week where they're 50, but obviously 80 is excessive. And so, you know, they did it because they had to. But they should be compensated for that somehow.
Well, the health department, the only exempt employees are Christie and Donna. So anybody else over there who works over 40 hours,
Okay.
Yeah, they got comp time.
We gave them
yeah.
time and a half, if it was 40, they were 40 that week, we got time and a half, so, for comp time, so. And they've used some of it they haven't used.
That's reimbursable.
Comp time, yeah.
So we need to find
Still reimbursable.
somebody to oversee the program. We need to come up with an application.
Process.
And then, we need to get more clarification so we can actually start buying equipment if it's needed for, COVID-19.
So if somebody's already expended something that they feel like is COVID-19 related, I mean, is that something that we could take a look at and just approve as reimbursable?
I think so, yes.
just a short form, or, maybe a receipt with something that just says, hey, we've already expended these masks, or whatever that may be, for COVID-related activities. We'd like to get reimbursed for this.
I think as long as are you talking internally or externally as well?
I mean, I'd say both.
Okay, so I think as long as that assurance is in place that they're not submitting that to be reimbursed through any other federal funding, and that it was something that was not in their budget prior to. So as long as we have those assurances in place, I think that, yes, that is.
Yeah, I mean, I think that's a fairly short question answer. You haven't turned this in elsewhere.
So do you want to say like prior to today? So that things going forward, we go through some sort of application process, so anything expended prior to today, they could go ahead and submit receipts and things like that to try and get reimbursement, and we'll review those?
Yeah, I mean, I think as long as we can get some type of service on board so that we can start compiling all this stuff. That's just my opinion. I mean, I don't think the expenses are, other than the expenses that we've already expended through EMS, I mean, I don't think some of these others are gonna be too much, but I don't know. Obviously, we can take a look at them. If we have questions or something, we can send them back and try to get clarification.
Okay. So, do you want Jessica to work on RFQ for a consultant?
Yeah.
No,
Have we done them all?
sooner the better.
Okay,
What teasing?
she doesn't work for me.
I know.
Okay. Are there expenses that you guys have at the moment? Like Christy mentioned, the software, something that we need to approve right away to move forward in the process at the moment?
We don't, they're just looking into it.
Okay,
I don't even know how much it costs.
okay, so,
We're presently working on the antibodies and, those different tests and mobile test kits and things like that, which have a big aspect on the PPE utilization in the hospitals and with us. So those things are kind of on the horizon.
okay,
So those are the things you can get kind of that approval to push forward with those and to bring them forward, or how are we doing that? And part of that is others, we can do those under emergency procurement processes, or we can go through the other product. We just need guidance on that more than anything.
Carrier, Steve?
Is there a way that we could develop like maybe a Google Docs sheet or something that, we could all share or something, and just kind of make notes on it or something, just to, or if you're gonna prepare something, but I was just thinking some type of a brainstorming document that we could try to start checking stuff off, or just putting stuff in there. I mean, sometimes you start bouncing ideas off people, and if you can see it all, maybe you can add something. So I don't know. I'm just
well, so.
throwing out ideas.
One of the other suggestions through the NACO presentation was, I want to get the right wording for what they called it. So we could go out with issuing a notice of funding opportunity to give people the time frame to come up with those ideas and submit them, so we could kind of create that running list from other communities and internally.
Okay.
So maybe we could prioritize what some of those immediate needs were.
All right. categories. And a lot of times, somebody comes up with an idea, and well, now all of a sudden, I think of 3 or 4 or 5 other things, and so I could just jot them down there. Now, you know, now we create a list for education, for protection, for resources, or whatever, and so sometimes those things help other people think of other things that maybe might qualify, and then we can, you know, some things we can kick out, and other things we can add, and it just seems like it's, we gotta start somewhere, and,
So one of the things that I saw was a couple places are doing, like your PPE related type things, your treatments, your testing, things like that. But here and now, they're doing that. We're more on an ad hoc, as needed, bring it up, you know, and the other ones were like a 30, 60, and 90-day notice for funding opportunity type stuff, and right, everybody submitted their stuff, and then it went through the approval process. But, you know, the 2 places were doing it differently. One was specifically that reimbursement, right? If you felt it was important enough that you had to do it, it basically assured, kind of a loose term, that it was COVID related, right? Because if you weren't going to do it without the funding, then was it truly COVID related or not, right? So that was one way that they looked at it. But the other place was doing that, it was grant approval first, and then the funds could be expended. So those were the 2 avenues that the different places were going. One was you had to purchase first to help basically prove that you felt it was, you were willing to roll the dice, basically, I guess was the way that they had worded it to me. And another one was that, but I do think that if you have, because there are going to be things that are gonna pop up in a month that we're not thinking of, or something could happen that we're gonna have to come and go, hey, I needed the NOFO is for this time frame. But we need to look at this now, and so having that ad hoc ability is something to keep on the radar.
I think that's why you're doing the RFQ though. I think, I don't wanna get too far ahead here, because I think that the person that you're gonna be bringing in to run this is gonna have those ideas. They're gonna take those notes, they're gonna be able to push those out to everybody. I like your idea, Chris, because I know we have some expenditures out there. I know he does. I know we get a lot. I know the city does. So if we could get out there and those initial ones that we've had since January 1, and can push those out and get reimbursed for those immediately.
Not January 1.
Why is that?
March 1.
Well, March 1 then we can go ahead and move forward with that one and get that paid off. But then you get your person online. You could even nominate, get those committees going that I was talking about, and coming up with ideas, and then those committees can come in and do presentations, and everybody can look at what's going on. But I don't want to you get too busy with this, and you're going to get lost.
Take us a year.
Yeah. So,
Money has to be
well, it has to be, it has to be spent in a year, it has to be encumbered by December. So, I think first thing is your RFQ. That's a good idea. We need to get that person on board, because they may come in and go, hey, everything you guys talked about was stupid. This is how we need to do it. These are the tiers we need to do, and to do it right, we need to do it this way. They won't say stupid to me, of course, but I'll be on it. But if we can move forward with that person first, and then in the meanwhile, do like Chris said, and those expenditures that we've had since March 1, we can relieve and help the other entities around here by allowing to reimburse some of those funds.
And the consultant fees are eligible expenses for this, so the person we're bringing in to do this consulting can be covered by the funding itself.
And part of the RFQ, will the consultant have the experience there to be able to guide us on what would be allowed and what not, or are they just gonna more or less manage, all the documentation and kind of manage the fund? Or we're looking for both?
I think both at the moment. I mean, the recommendation from NACO was you wanted someone well qualified with at least 10 years of experience dealing with federal funding. So, I mean, I
Does
think
Williams Keepers have that?
probably.
We're using them now. I mean, I understand you're gonna go after RFQ, but we're using them now, and we need to move now, so just my 2 cents worth. Because what I would rather not wait another month for us to be able to go out to RFQ.
Well, RFQ is, I mean, that can happen pretty quick. Yeah, so,
Because you don't have the same publishing
right.
Deadlines.
that you do for an RF.
I mean, I think it's a matter of making a few calls and getting a proposal sent over, and we can move forward.
So that's our first priority.
I just think we still need to continue that PPE, maybe not putting a deadline like today, everything now starts a different process for PPE. It is still, the supply chains are tightening, they're not getting better. Because as people open up, now you have entities that were not open, dental offices being an example. Now, every dentist, dental office in America is trying to find a PPE. And so it's actually more constrained, not looser to find PPE. So to wait to obtain those items is not smart and is actually probably going to put us in a bind at some point, because stuff we ordered in March, we had 2 boxes show up today. And, half that order doesn't ship for another 10 days.
I don't think they're saying though that we're stopping to do what we do in business. I think they're just wanting to reimburse from March 1st till today to get that quick reimbursement monies out there. And we can continue to buy like we've been doing on your emergency purchase and online. I mean, we can continue to do that, and we just hold that money though until the RFQ gets approved. Is that what you thought too, Kristen, or is that, or Jeff, or?
I guess the downfall of saying like, hey, go buy whatever you want, and I'm still gonna. I thought the deadline of today would get you those quick funds for already expended,
Right.
and then.
And then we have to go through the process.
Right.
We can't do that. I mean, we can't.
I think there can be an exception for PPE if that's
Right.
something we feel is an emergency and has to be
So I
ordered.
think your testing supplies and your antibody stuff, right? Because I can get those, at least we're working with ones we already have a contract with. So it's not something that we would then have to go back out. I've already got a blanket contract for medical supplies with them through Medline. So we have that in place. And so it would just be approval for expenditure versus having to go out and bid. And then the PPE process, we're working with, seeing if we got one on cooperative, because we have found a solution at least that works for EMS, that at least gets us to where our PPE crunch from a mass standpoint is no longer present. So for us, those are our priorities that we still have to be able to do quickly, not go through a 30 to 60 day process. Because in 30 to 60 days, if you have a spike, if the supply chains continue to contract, or crunch, availability, that's going to be an issue.
Steve had a question or comment?
Yes.
Contact tracing software specifically says we can use the funds for contact tracing, so if we decide we want that contact tracing software, we need it quickly, because if we have a spike, it's gonna help us track our cases faster.
I mean, I think there's things for the respond and the protection sides that are immediate needs. And I think there's some of those other things that can go through whatever process you gentlemen determine, but there's some things that I would at least advocate that we don't need to put too great of a window or process on.
So PPE, can you order enough to get us through till the end of the year? I mean, is that
So it depends, right? So one of the things that we're looking at is called Clean Spaces. It's a system that would work very well for at least EMS. We've invited all the other agencies to come try them on yesterday, and they did a presentation. They came up and did all of that, and had a Zoom meeting with the actual sales rep, but they were hands-on with them. I don't know if it works for them. That's their agency. They're welcome to, go through whatever process or what they want to do. For EMS, it works really well. And so what that does is their filters are not in short supply, so we can get those, and then I have the ability to get enough filters to where then I can meet that need through the rest of the year, at least from a respiratory protection side, from a protective suit side, things like that. Those are still very tight, and the masks are even tighter. So again, that's why we're more so shifting towards that route. It's because it's something that is reusable, sustainable, and I can get through the supply chain now.
okay?
Steve?
To Matt's point, I know you talked about it at one of your prior meetings, but, a little bit to that is that the county is gonna be providing some of that equipment for the the cities, Jefferson City in our case, great, that's good to know, but if not, we also need to know that, because then we're gonna have to go out and do, the same thing for, that same kind of equipment, so some coordination there. And I just wanna mention, I know that there are some counties that, are allocating, some of that money by population. And we do appreciate being able to be involved in the conversation with the cities.
I think that's why earlier we need to continue to work together. If there's things that we can order together and use, that's great. But like Matt said, maybe what works for him doesn't work for law enforcement. So maybe we need to group law enforcement together to order something that works for all of them, something that works for medical. Maybe that's something different that works for fire. I don't know. But I think we all need to sit down together and figure out if there's those items that we can purchase together.
December sounds like a long way off. But to
It's
John's
not.
point,
No.
It's not.
pretty quick.
So maybe at this point, besides going out for the RFQ, we need to have some working sessions with maybe someone from fire and someone from EMS, someone from law enforcement, working together to see what those immediate needs are. And if
Those
it's
can
some,
pretty much be done via emails though, can't, you don't have to sit in a meeting, do you? You can write down on a list what you're needing. And y'all know what kind of mask you like to use, what kind you like to use.
We are,
And
JCPD and I have already been talking
So-
on this stuff, so, we got a pretty good idea right now, but
that's outside of this money though. This money here, we just gotta get a process figured out. I think we're getting down in the weeds too far here. And I think if you need something, you need to buy it. If we need to do something to mitigate, if there is a spike and to be able to handle it, we gotta get it. We gotta take care of getting that and not worry about this money and who gets what out of that. This is gonna be a whole different process. And that's what we gotta get. If we're gonna write a grant application for it, there are teen millions of grant applications out there that we could probably get something through emergency services, and we're applying for them right now. We can go off of it and make it as easy and simple, or make it as hard as we want to. And we know what we have to prove that you had the expenditure for those items and what kind of records we're gonna have to have on hand, and go from there. So, I think we just need to worry about the process at this point. So if we get the RFP out,
RFQ,
sorry,
and then you want that person to write the application?
that depends. We've got all kinds of applications that we apply for, grants that we can template off of. And I think it just needs to be relatively simple. I think the biggest
I
part
think
of it's
simple,
gonna be the
yeah.
record keeping and the maintenance of all that stuff, so.
I don't think claims keepers are gonna have technical experts in the different aspects. They're not gonna know what law enforcement is their job. They're auditors, they're CPAs.
They're gonna be a record keeper,
yeah,
per se, right?
Yeah, those are the guys that's gonna have to approve it. Once they approve it, all Winter does is do the check.
Cool, so you gotta be nice to us.
Seriously. For us, seriously, well, I usually.
I don't know, I'm just teasing you about being nice. You're always nice,
Most of the
except for
time.
when you aren't,
But,
so.
yeah, so I'm not as worried about the technical aspect as I am about getting somebody in place and moving forward.
I mean, it's just, the grant application, there's no brainer stuff, so I think keep it simple. And PPE, obviously, is something that's simple. So, you don't have to have 72 lines of an application that you gotta write out. I mean, it's not a high school application, and I want you to tell me about your experiences.
You still want a drop of blood?
Yep, DNA, so. And it may have to be a living, breathing document too, that we may have to change as we go. Maybe you get the application, you need more information. Or if it's one of those gray areas, you ask more questions at that point, so.
And there could be more than one consultant too. I mean, William Keepers could take care of all that. paperwork and making sure everything's good, and then we could maybe have another consultant that we kind of run stuff by and make sure that it's a allowable expense. You know, if they have some expertise in that. I know Lincoln has some of that with the RPC, but, you know, they, so, and not everybody will have everything that we're gonna need, so.
Did we do anything today? Any accomplishments here?
Well, we're getting
We're gonna do an
closer to
RFQ.
creating, yeah,
Okay.
somebody to oversee it. We're getting closer.
I think this is gonna take
To-
multiple
to
meetings
getting
and multiple
an
times to talk about
I
it.
just don't feel like we did something today. I don't know if we accomplished it.
All right, if you-
So I think you need to approve it, and if you're allowed to today, per tracing software, contact tracing software under emergency purchasing, because
Well, we can put that on Tuesday's agenda or next week's regular agenda. Right?
That gives you
Once
enough
you
time
have
to
some time
research
to
it.
get the,
If you're taking submittals, can we submit some?
Sure.
Actually, that's not a submittal, that's just a county expenditure before the reimbursement thing. So, it's, I mean, we've got some other things that were mentioned, like, hands-free towel dispensers and stuff like that. I mean, we need to consider that if this is gonna be around for a while. I mean, I'm old school, I just wash my hands, grab the towels, and then use it to open the door and, you know, get it figured out.
I did want to mention that for contact tracing, we did not plan to ask for any additional staff. I know the recommendation from, I think, NACHO or CDC is 30 contact tracers per 100,000 of population. So, like Jackson County plans to ask for 38 contact tracing staff plus data entry plus, I forget all, but they're gonna ask they put 52 people into their submission along with 52 phones and 52 laptops, everything for like 1,440 hours. But, without knowing what our cases are gonna be like, we don't plan to do that. We just plan to train basically everybody in the health department to be able to step in and help whenever is needed. And then EMS also volunteered their staff to be trained, to do contact tracing in the event that we would need more staff. And JCPD actually volunteered their staff to do that as well. So if we needed to stand up, we could easily provide some quick, just-in-time training and have staff help with that as long as they understand the forms and understand HIPAA. We don't plan to hire additional staff for that short time period because I'm not sure what they plan to do with them after December when the funding's not available.
right.
And then 52 phones and 52 laptops. I mean, it was a lot of expenditures. I asked a few other counties just to see what they had planned to spend it on. And that's what Jackson County plans to do, is hire a lot of people.
Steve, did you guys have something that was immediate that you were thinking that you,
It's on your definition of immediate. Like, you know,
contact
if-
tracing software or PPE, something, I mean, that you need
Yeah,
funding immediately?
Could be, depends on, you know, who's gonna be taking care of all the masks and all that kind of stuff.
So if they go with what we're going with, we'll continue that process. If it's something that they're not going to do the same as us, then it will be each agency's responsibility to manage their PPE. We're not gonna manage 6 different types for 6 different entities. That is, I don't have staff at the time. I don't know what your burn rate is versus our burn rate. If you use it and it's not something that's a collective use, it's on you guys.
So you're not gonna, once you get your new, this new gizmo, then you're not gonna do the N95s anymore?
We'll have N95s, right, but we did something different for you. Outside of, you know, if you want XYZ N95, and they want XYZ N95 or something else, or Pappers, or whatever they are, I'm not gonna manage 4 different things. I'll have standard N95s, because we have to have those,
Right.
and we'll have, like for us, the clean spaces. If anybody goes outside of that, that's their agency's responsibility to manage and maintain that, because they're not mine personally, right? So,
And at the current burn rate, we can probably do the other entities for what, 60 days? Our current burn rate, I would guess, burn rate.
we went to a different process.
Right.
With the supply chain.
I think before we authorize any purchases for non-Cole County agencies, there needs to be some sort of form or agreement in place where they certify that this is going to be purchased and used in compliance with the requirements. And if it's not, that the entity will indemnify Cole County for any kind of expenses, so we don't get burned on having to pay back something if a non-county agency doesn't expend the funds
Correctly.
according to the act.
Even a request, I mean, obviously, I just kind of thinking about municipal court, if you're gonna be giving mass to people at municipal court or our courts or whatever, but I mean, there almost should be a documentation that these masks are for court-related purposes and just to document that. I mean, versus just, hey, we need 2,000 masks, well, what do we need 2,000 masks for? I mean, so this for,
And they're gonna be real hard to get.
Well, Judge Joyce is gonna require anybody in the courthouse to have a mask on.
Probably need to make that order about 60 days ago.
So, she's hoping that people will have their own mask and they'll bring them, but
Yeah, what type of mask? Just like a cloth mask or?
I don't think she can prohibit people from coming in, because the courthouse, you have to be careful because people are entitled to due process. So,
I actually have a letter that she sent out that is supposed to be going out. Would you like me to read the press release? That she
yes,
sent?
yes.
Phase one, if we do not have the pandemic repeats itself. Phase one of reopening the courthouse would start on June the 1st. There will be limits on the number of visitors to the courthouse at one time. No more than 10 persons would be in any courtroom or office. All areas of the courthouse have been marked off by 6 feet to achieve social distancing. In order to achieve the capacity limits, priority has been given to felonies, juvenile cases, orders of protection, and so forth. Everyone coming into the courthouse will be screened for COVID-19 symptoms. Temperatures will be taken, contact information will be gathered. Family members and friends will not be able to enter the courthouse unless with the litigant, unless prior approval is obtained. Every person will be required to wear a mask except while testifying, and they should bring their own masks. Enhanced cleanings of the courthouse will continue. That was put out at noon.
So will we turn them away if they come to the courthouse without a mask?
So this has nothing to do with us
No, I
and
know,
money.
I know, I
So can we
know.
go back to talking about
Yeah.
that and stuff?
Yeah, well, I was,
If we're gonna
With
do the
the courts,
RFQ,
yeah.
trying to figure out the process. I mean, you can ask for money, I mean, let us know you're gonna be asking for it, but I don't know how you're asking for it, when we're not even gonna be able to ask for it from ourselves apparently at this time. So, if you're gonna buy it, we need to do it to mitigate any kind of spike or peak or whatever. And then, we're gonna do it anyway, we've got money in reserve, we've been good with our money, so we've got money to cover this stuff regardless of this $8 or $9 million. So I think we just need to work on the process at this point and get that step done first. And as far as the application, I nominate you to help write it, Sam. So, or like Chris said, you can have a document that we can all comment on, and I think this is something that should be down to emergency services, right down your alley. So that can be a good starting point. And she's probably gonna pull her hair out, and we'll find out if she wants to stay here after all this part. But, so, that's just where I'm at. Let's get this process going.
mm-hmm.
so you want Kristen to go ahead and push on finding the consultant?
Mm-hmm.
You guys wanna vote on that?
So the purchasing agent to do the RFQ, right?
Right.
Not
Yes.
Kristen.
Correct.
All right, trying to help you out here. So, yeah.
So you wanna make a motion?
So I move that we, ask Jessica to get the RFQs started for the CARES Act. Huh?
Consultant.
Consultant.
I'll second it. That's what I was thinking, how we needed to word it.
Right.
Yeah,
She knows what we're looking for, so. Or does she?
any discussion? All in favor?
Aye.
Okay. And maybe we can
So-
start working on an application.
Yeah, I'd say if you can kind of draw something up, it can be as rough or fine tuned as you want to make it to start with. I'm sure it's gonna get changed up here, because it can be as objective or subjective as we want it to be too. You know, one person may feel something is related, and one person may feel you don't want your money going towards that. So,
I think we need to work on the easy ones first, protection and
Mhm.
education, and then the other ones can come later.
Then we'll have hopefully clarification later.
Do you want to do anything with any expenses that have already been incurred?
I honestly don't. I want to wait till we get some kind of application and process set up.
Well, they can
before we
be
do it.
submitted, but I mean, we,
Yeah, I wanna wait till we get the consultant
Yeah.
on board.
Okay.
yeah,
We
it's,
don't have anything for them to submit.
no.
I mean, I'd keep it just like you were gonna request it anywhere else. We don't know what other
Yeah.
funding's coming
A
down.
request for reimbursement and.
So right now, the internal process for the departments, if they have an expense that's COVID related, is no different. They're going to come and ask either for an emergency purchase or to bid or whatever
or
to you guys.
Transfer or
Okay.
whatever that is, so.
And I would assume it'd be the same for y'all. If you need some down at the city, you're not gonna wait to find out if this is coming before you go and get it if you need it tomorrow. Because obviously, we don't have this ready.
If it's, we've already purchased some, a lot.
Yeah.
There's some other things we can continue doing that. It's some of those future things that, you know, may be worth talking about, but, you know, time is an issue, obviously.
That's where I think, you know, at least from my standpoint, if I knew what kind of things you were thinking about or whatever, that we could say, yeah, this is COVID related, or nah, maybe that's a stretch, or, I don't know. Maybe you don't wanna do that in open session or something too, I don't know, so.
Well, and I think,
This is a fire list that we-
Huh?
I was gonna say, I think some of that's dependent on what happens with the mask that Matt's looking at, if that's going to
Yeah.
be everyone else going out and finding something different if they don't want that mask. I mean, I think that could play a big part in it.
I still think it'd be easier
Well-
if Matt purchases for everybody. And
The mask-
law enforcement's gonna need something different
Yeah,
from,
it's not gonna work for us. The one he's looking at, it's not gonna work for us.
well, I know, but I mean, still,
So I think that's gonna play into what some of those purchases that are going to be somewhat immediate, if he's saying I only have 60 days
Well-
worth of this, then in 60 days, you're gonna have something else in place.
Well, it's not fair to him to have to order all our stuff. I mean, we
Right.
don't let it, suppose he can.
Right.
The agencies need to come and make their case, not that whoever that is, from city or county or whatever, for them, they know what's best for their employees and their environment, but they're not, but, right, ours are different than the sheriff's, and hands down, we operate two different worlds, they just merge at different times. And so, I think that's kind of, what we don't wanna do, is we don't wanna tell the sheriff, hey, you have to get these things, but we also don't want the sheriff or anybody else telling us, hey, you have to get these things, because we're different than they are, like, you know, there's just too much, we all have different jobs, and so I think for us to at least continue to go through the county process internally, for us until this all goes about in the right move, because we can at least come in and still keep that ball rolling.
Anything that's compatible, then I'd just soon have you do it.
So are you
If he has, if they need a special something, if JCPD needs something, then,
So are you gonna
then
continue
that's
to work
fine,
with
but
95?
I will, but the only request we have is that if people are getting the 95s outside of our maintaining, we need those put into the kitty, because people, agencies are getting the 95s and they're not putting them into the kitty, right? So they're getting their own and keeping them, but yet we're maintaining a stock and then doling out in 95s. If you're getting PPE, put that into the kitty for everybody, because we're pushing it out to everybody. And so that's part of where it doesn't help our calculations of, well, you have it, you don't have it, well, we got some, we don't have some, we got some extras, we didn't. It needs to come into this, if we're going to maintain that central PPE repository for everybody in the county, that means for everybody in the county and everybody that gets stuff needs to be put into the kitty then.
Are you referencing the stuff that comes from DPS?
Wherever it comes from, donations from people that are, you know.
But we haven't got any N95s in from anybody.
Some have, you may not have, but some have. We've been slight program at this point. I mean, we've fit tested about 500 people, and we have provided masks to all those departments.
Because you're not getting any returns. like
That would
you're
be
saying.
correct.
I got you.
So is that making the burn rate not
So it
able to
changes it.
track
So it's
either?
harder for us to track, right? And different, if they get an N95 that's not the same type as what we're already having, then we have to look at, all right, you may have N95 sizes that we're low in stock on that we can then shift towards people who, so an example would be,
1860s.
1860s are harder for us to get than the 1860S's. Well, it's a different size, same model, different size, but a Moldex extra small might be the same as an 1860. So then we can shift those around. So we have a good idea of this brand and this brand, these sizes are pretty close to each other. But if everybody's keeping their own stuff and not putting back into the kitty, eventually the kitty dries up, right? It's where everybody else still has it and we're still kind of holding it. So if we're getting PPE in to any agency, it needs to go into the central repository. And then it can get pushed out and then we
That's a
can
good place
manage,
for it.
because
It'll
daily
catch
we
your,
count and we
crumbs.
look at burn rates and do all that. If that's not happening,
You can
that's not
eat
fair
later,
process.
snack later today.
And at some point, we may end up hurting the entire group that's trying to respond to this, because we may be able to, someone may have a size that we don't have at that moment in time because we could not obtain it. And we don't even know they have that size because it's sitting in a warehouse somewhere, or it's sitting in a back room somewhere, or whatever that is. PPE needs, if we're going to be responsible for supplying this, it needs to come to where we have it and we can push that. Not a single person has come and said, I need PPE, has been told them, inform us. So, it's not, there's no reason to be worried.
Okay. Anything else?
I don't have anything.
Did we
to
give you
comment.
some direction?
We need to sign that, or talk about that RLF.
Oh, yeah.
Sorry, put that on there.
Done?
I got that.
Revolving loan fund,
Oh, the other thing that was on there for 2:30?
See, Larry, that's my shoestring. This would match your shirt.
I'd be afraid of anything you've ever breathed into.
Such a thing.
I've had my shots.
Oh, leave that alone. If it's a bottle, maybe something different. It has its own characteristics to take care of that.
So this is a revolving loan fund for the Regional Planning Commission, and it was a financing opportunity through EDA, and anyway, it was a 95-5 grant, and so they're looking to have a $2.5 million revolving loan fund, of which $1 million would be for Columbia and 500,000 could be for Cole County, Jefferson City. The match was 5%, and Chamber had talked to me about us partnering with them to come up with the $25,000. I was trying to get some more information here. So some of the joining regional planning commissions have a revolving loan fund, and so funds designed to provide loan money to small businesses in order to induce private lenders' participation in projects will retain or create employment. Some funds can be provided up to 40% of the funding, and sometimes there's a maximum. But and then sometimes there's jobs attached to the funding as well. But I mean, it's a good economic development opportunity, and I know most of the county commissioners in the 6-county region were pretty excited about it, as well as some of the economic developers that are part of that group as well. I know I kind of sent something to you guys about
Yeah,
it.
you had
so-
talked to me, I thought it was good, helping, new businesses with economic development.
So how much
It's
is
good.
the whole thing? It's $500,000.
Yeah, so it'd be $500,000
That's gonna be in revolving fund.
Yeah,
So then
for Cole County,
we put
Jefferson
in
City.
12.5, that goes towards what? To help them,
To help with the match, so the EDA would come up with 95% of the funding, and we would have to come up with 5% of it. At least that's what the application would ask for. And most time it's an 80-20 match, and this was something that David Bach, who's the director up there, talked to me about, and so just a good opportunity to help local businesses get a loan or maintain a loan, or opportunities for them to be successful. And
so is this guaranteeing their loan, or this is part of their
no, this is
match,
it's
or-
part of a loan. So the whole 500,000 would be a loan that the RPC would then administer and be able to reuse once the loans were repaid, and it would just continue for perpetual. But there'd be $1 million for Columbia, Boone County, because they were gonna put in $50,000 to cover their match. Then there'd be $1 million for the other regions within the 6 counties, so.
I think it's good. I think it's good.
I guess I don't understand it. It seems like this is something the banks should be doing, not the counties. The Bank of Cole County here to loan people money. If it's a small business needing a loan, then they can go out and get an investor to help them. If it's, $12,500 in $500,000, that's not much. So I don't necessarily see it as something the government is needing to be involved in here. We're picking winners and losers kind of in my book on it, so. And I just may not know enough about it.
Right.
So,
Well, I mean.
you
we're-
need to know something today, or?
Mhm. Yeah, always in a hurry, so,
I'm gonna know today, so.
yeah.
So our portion would be 12.5, and
Right.
then is the chamber doing 12.5
12.5, that's correct, yeah.
to make up the 25?
Total $25,000, which would create if the grant was successful, then there'd be $500,000 to loan in Cole County, Jefferson City.
They can't just give us a grant for all of it? You gotta hold out 25,000.
Have some skin in the game.
That's really not a bad match. I'm in favor of it, so If you
It's not.
make a motion.
What are we getting out of it?
I feel good. Don't you feel better?
Economic development.
It
What
is,
you're
that's,
getting
it
at.
it is economic development.
For who? What are you getting out of it? There's, if they get the loan and stay in business, then can't they get the loan themselves, or what's?
Sometimes loans are a little marginal in what the bank will be willing to lend, and so this kind of a gap financing, that, you know, obviously they're not gonna make some real risky loan, but sometimes banks will only go out, and loan so much of what they're wanting to do, and so this, kind of pulls that other partner in. You know, you just talked about a private partner, well, this is
Okay,
kind of your
so-
private partner.
So this would be an investment, so then what's our return on it?
Jobs.
Sales tax they pay, and,
What if-
property
what if they're
tax
a-
they
What if
pay.
they're a service, there's no sales tax on it? What if they're going to go into carpentry and there's no sales tax on that?
They're buying goods.
Not necessarily, homeowner can buy the goods and they're doing that anyway. I got all day.
Make a
Why-
motion, make a motion, I'll
Why
second.
couldn't you argue earlier?
Make a motion, I'll second
That's
it.
it, it's another day.
Uh,
All right. I move that we sign the letter in support of the revolving loan fund match commitment.
Second,
Coming out of economic development.
all in favor?
Aye.
Aye.
Yes.
Opposed?
Nay.
Okay. Is there anything else? You got your taser on you, Sheriff?
Nope, I got
Hey, I wanna know.
rounds, one of them hit you.
Oh, yeah.
Here, sign that so I can send it to him.
Sure got the other 14.
Let me move first.
Is there
Stay for a minute
anything
and
else?
sign transfer.
No,
Oh,
I
did
move
you
we
sign
stand
the
in
transfer?
recess till 4:30.
Second.
All in favor?
Aye.
Cause I think everybody else signed it.
I did. Thank you.